Hi everybody, Dr. Jason Kistler here, and I am in my office, Align Chiropractic in Fraser, Pennsylvania, and I wanted to shoot a quick video explaining proper ergonomics when using a computer, in particular a laptop computer at a table. Now, right now, a lot of people are working from home, which is, definitely a blessing if you've been able to continue to do your work from home, because there are so many people out of work. But if you are continuing to do your work from home, you want to make sure that you're using good ergonomics. I am getting a few patients, new patients coming into my office with a lot of pain, a lot of trigger points, muscle tension that's caused by poor ergonomic or poor workstation. In addition, I have a lot of patients, current active patients, who are getting flare-ups or getting new problems because of the same issue, that they have poor ergonomics, which is causing a lot of problems. In particular, what I'm seeing, or a lot of my patients are experiencing, is a lot of neck pain, neck tightness, and trigger points, which is sort of when you have an area alongside of the spine, sort of in this area, and you feel a large amount of pain in one particular area. You can usually push into it, and there's a knot, there's a lot of pain, and it's traveling maybe down into the arm or up into the neck. That's usually a trigger point. There's a reason that those things happen, and this video isn't going to be geared towards what you can do. I am going to shoot another video to explain what you can do at home if you do develop any of these issues to help minimize some of those problems. This video is going to be more geared toward how you can properly set up your workspace at home to prevent these issues from ever happening in the first place. As they say, an ounce of prevention is worth a pound of cure. That's the way it goes. So first I want to show you what the problem is that a lot of people that's causing a lot of the problems. A lot of people's workstations, I imagine, are going to look something like this. People are probably using, for the most part, laptops whenever they're working from home as opposed to a desktop. Big problem with using laptops at a standard size table, such as a kitchen table, is that generally you're looking down at a laptop. As opposed to the best way to use a computer is to look straight ahead. You want to look straight ahead whenever you're looking at a screen for long periods of time. Otherwise, when you look down, the normal position in the spine, this is normal structure of the spine. There should be this nice curve in the neck. Well, if you're looking down for long periods of time, what you're doing is you're taking that normal curvature out of the spine, and then the muscles that are attached to the back of the neck will get very tight, or they'll tighten to prevent any damage to the skeletal structure, to prevent that from causing other issues. And that over a long period of time is what's causing trigger points and other muscle spasms and a lot of discomfort. So the goal is we want to be able to look straight ahead, as straight as possible. Another problem with this is that my arms aren't at a very good position. Optimally, we want our arms to be slightly open between 90 and 120 degrees is where we would like our forearms to be. Another problem with this is that if you have a standard chair, such as a kitchen chair, and you're at your kitchen table, it's all right to be in this position where my hips are at about 90 degrees. It's all right to be in that position for a short period of time, maybe a half an hour while you're sitting at dinner. It's not really going to cause a big issue if you're in good posture. The problem comes when you're in this posture for a long period of time, especially repetitively over multiple days, say 5 days a week, 40 hours a week for a long period of time. It's going to start to cause issues. The reason being, when I'm in this position, my hip flexor muscles are going to start to get very tight. And then whenever I stand up, if I have tight hip flexors because I'm in this position for a long period of time, when I stand up, those tight hip flexors can actually start to cause low back and hip issues. So optimally, whenever we're sitting at a desk or at a table for that matter, we want our hips to be open slightly, just like the forearms, at between 90 to 120 degrees, somewhere within that range. So one of the first things that we're going to want to do is we want to fix the chair issue. So you want to be up at a higher level than what I'm at right here in this chair, which is why a lot of desk chairs are able to go up and down. So if you have a desk chair that is able to go up and down, that's great. If you don't, put something underneath of your butt. If you're a patient in the office, you have a wobble disc that you can sit on at your kitchen chair, and that's going to raise you up slightly. So what you want, or the level that you want, I have a rolly medical chair here. So this is bad position. I'm going to raise this up. So for me, this is great. This is a very good structure, very good position of my hips. Now, whenever I raise myself up, raise my chair up, you can see that now I'm actually making this problem even worse. So I'm looking down at my laptop. I have good form in the rest of my body, a nice arch in my low back. I'm trying to keep my body up nice and straight, but even if I do that, my arms are at a good level, I'm looking down. So if I'm doing this for hours a day, I'm going to develop some real problems up here in my neck. So once we have this position down, we have the body in the right position, the hips in the right position, we need to get the computer in the right position. And here comes the problem if you're using laptops, albeit I understand it may be necessary for you, is we're obviously going to want to raise our screen up. But if I raise my screen up a little bit, let's say right here, still too low for me. Too low. I still have to look down slightly, so over a long period of time, going to develop some problems, as well as my arms are going to get a little bit fatigued at being at this position. So I want to, for my neck's sake, I want to raise my computer even higher. So for me, this is great. This is perfect. My computer is nice and high. I can look straight ahead to do all of my work. I'm not straining my muscles in my neck. I'm not going to cause any problems. However, the big problem is now my arms would have to be way up here, going to cause some potential shoulder discomfort and cause some discomfort in other areas. So the solution to this is that if you can, which anybody can because there's something called Amazon, which can ship it to you, get a separate keyboard that is not, and don't use this keyboard on your laptop. Instead, get a separate keyboard. If your laptop supports it, you can use Bluetooth. If it doesn't, you can get a corded keyboard and plug it into the USB cable. Get a separate keyboard, get a separate mouse. That way you can look straight ahead at your laptop screen. You can do your work with your arm in good position, with your hips in good position, with your head in good position. And this is going to prevent you from developing any of these problems in the first place, or at least prevent them from getting worse. And then, of course, get proper treatment or do the right things to help those issues if you are going through those right now. If you have any questions for me, please feel free to write a post. Share this video with someone who you know who may be dealing with some problems. If you do have chronic neck problems, you're not a patient in the office, we are continuing to see patients right now during quarantine. We are screening people before coming into the office to make sure there are or to mitigate any risks. And to make sure that we're doing all our due diligence, but we're still seeing patients to help prevent you from, of course, just being at home suffering with these issues while you are quarantined at home. Again, if you have any questions, please write them, and I'm glad to share this video and look out for our future videos.